Every person has dreams, aspirations, and ambitions in life. A lot of effort and support goes into achieving them. But what happens when life doesn't support?
I saw a child in the morning who was in so much pain and was screaming and saying, "I don't want to live. I want to die. I can't bear this pain anymore." Parents were so upset, they all started weeping. They just could not see the misery of the child. I have seen in my career that if you have a disease like cancer, how much they undergo the suffering. It's not just about the patient, the entire family suffers. Suffering is something which cannot be described.
Cancer, an obscure disease, and the second most common cause of death in India after cardiovascular diseases. It is estimated that 14.5 lakh people are living with this disease in India, with over 7 lakh new cases being registered every year. This translates to almost 1 in every 5 being cancer-related deaths.
I have a medical role to play. As a doctor, I give medicines. I take care of the pain and breathlessness. But what about their emotional and social issues? Who is going to talk to the family? Reassure them and tell them this is what we are. We are there for you. We care for you. In palliative medicine, we try to give holistic care to such patients, addressing not just their physical ailments or physical symptoms. We also try to address social, spiritual, and emotional part of their suffering.
Cancer patients need more than just physical treatment. It's more about the serene support to the mind, more about emotional and social support that can help patients learn to cope with psychological stress.
Same case as my dear father, who had cancer, and after the tumor was removed, he just survived for just about 3 months. In the last few days, he was deteriorating very, very fast, and he also, there was slight bouts of pain, but then the palliative care people came into action. The doctors told us about palliative care, and that pain was eased away. And not only it was eased away from my father, it eased away from the whole family. The whole family was so much at ease, so much at peace. This peace that descended on the house, he went away peacefully with a smile on his face.
It is not easy. Yes, it's a very sad. Always it's a very sad part of our care. When we lose some patients, we get very close to, we get very attached to, and we try to give our best of care, and still they leave us. That is what I think. It's again we cry, and we don't feel ashamed to cry. We cry with our team members, and we share. I think, but also then we learn. We have over a period of time learn to empathize, but also not to take it inside too much, because then we can't. If we don't take care of ourselves, we can't serve others.
Palliative care is soothing care which supports the mind and the body. A palliative care team may consist of doctors, nurses, registered dietitians, pharmacists, and social workers. Many teams include psychologists as well. They are specialized in treating the symptoms, side effects, and emotional problems experienced by patients. Their aim is to help maintain the best possible quality of life.
When I think of my father, it's a very strong feeling, very happy feeling. Palliative care is there, and I do not wish pain for anybody, especially your loved ones, but if they are suffering, please use palliative care.
The goal is not about cure, but care. Support their lives, and let us be the physicians for the soul.